The nurse administers 500 milliliters of piperacillin to a patient with an infection. It must be delivered over 2 hours. The IV has a drop factor of 5. How many drops will fall per minute, rounded to the nearest tenth, gutty per minutes? A. 24.0 gutty per minutes. B. 18.8 gutty per minutes. C. 22.4 gutty per minutes. D. 20.9 gutty per minutes. E. 20.4 gutty per minutes. The answer is D. 20.8 gutty per minutes. Prescribed dose of piperacillin equals 500 milliliters in 2 hours equals 250 milliliters in 1 hour equals 250 divided by 60 in 1 minute equals 4.17 in 1 minute. Drop factor equals 5. Drops per minute equals 5 multiplied by 4.17 equals 20.85 equals 20.9. The physician orders digoxin 250 microgram. The label states, 1 equals 0.25 milligrams. How many tablets will the nurse administer to the patient for 1 dose? A. 1 tab. B. 1.5 tab. C. 2.5 tab. D. 2 tab. E. 0.5 tab. The answer is A. 1 tab. Strength of available digoxin equals 0.25 milligrams. 1 milligram equals 1000 mcg. So, 0.25 milligrams equals 0.25 times 1000 mcg equals 250 mcg. Prescribed dose equals 250 mcg. Tablets required equals required dose divided by available strength equals 250 mcg divided by 250 mcg equals 1. The nurse reads orders set by the primary care provider. She has prescribed 6,000 units of heparin 6th-hourly subcutaneous for the patient. The label on the heparin vial reads 1 milliliter equals 10,000 units. How many milliliters will the nurse administer to the patient? A. 0.8 milliliters. B. 0.5 milliliters. C. 0.9 milliliters. D. 0.7 milliliters. E. 0.6 milliliters. The answer is 0.6 milliliters. Available strength of heparin equals 10,000 units per milliliters. Prescribed dose of heparin equals 6,000 units. Amount of heparin that needs to be administered equals prescribed dose divided by available strength equals 6,000 divided by 10,000 equals 0.6 milliliters. The nurse prepares to administer medications to his patients. One order reads 0.4 milliliters of potassium iodide for expectoration. The label on the medication reads 1 teaspoon equals 325 milligrams. How many milligrams are contained in this dose? A. 22 milligrams. B. 24 milligrams. C. 26 milligrams. D. 30 milligrams. E. 28 milligrams. The answer is C. 26 milligrams. Available strength equals 325 milligrams in 1 teaspoon. So, 1 teaspoon contains 325 milligrams. 1 teaspoon equals 5 milliliters. Hence, 5 milliliters contains 325 milligrams. 1 milliliter contains 325 divided by 5 mg equals 65 milligrams. 0.4 milliliters contains 65 multiplied by 0.4 milligrams equals 26 milligrams. The nurse prepares an order of 600 milligrams ampicillin IM 8th hourly. The medication is available in powdered form to be reconstituted with sterile water. The vial contains 2 grams ampicillin and instructs the nurse to reconstitute with 4.8 milliliters of sterile water to obtain a concentration of 400 milligrams ampicillin per milliliter. How many milliliters will the nurse administer per dose? Round to nearest tenth. A. 1.6 milliliters. B. 1.5 milliliters. C. 1.2 milliliters. D. 1.1 milliliters. E. 1.0 milliliters. The answer is B. 1.4 milliliters. Strength of prepared ampicillin equals 4.8 milliliters containing 2 grams. 1 gram equals 1000 milligrams, hence equals 4.8 milliliters contains 2000 milligrams. So, 1 milliliter contains equals 2000 divided by 4.8 equals 416.67 milligrams. Prescribed dose is 600 milligrams. So, 416.67 milligrams in 1 milliliter. 1 milligram N, 1 divided by 416.67. 600 milligrams N, 1 divided by 416.67, times 600, equals 1.44 milliliters. Equals 1.4 milliliters. The nurse prepares an order of 0.6 milligrams atropine IM. The label on the available medication reads 0.3 milligrams atropine per 0.5 milliliters. How many milliliters will the nurse administer? A. 2.25 milliliters. B. 1.75 milliliters. C. 1.0 milliliters. D. 1.25 milliliters. E. 0.5 milliliters. The answer is C. 1.0 milliliters. Available strength of atropine equals 0.3 milligrams divided by 0.5 milliliters. That is 0.5 milliliters contains 0.3 milligrams. 1 milliliter contains 0.6 milligrams. Dose being prepared equals 0.6 milligrams. Amount of atropine required equals dose required divided by available strength equals 0.6 divided by 0.6 equals 1. You start a patient in the intensive care unit on a drip or phenylephrine, as the patient is persistently hypertensive. You think that this will raise the patient's blood pressure because phenylephrine's primary mechanism of action is which of the following? A. Beta-2 adrenergic agonist. B. Alpha-1 adrenergic agonist. C. Beta-1 adrenergic agonist. D. Beta-1 adrenergic antagonist. E. Alpha-2 adrenergic agonist. The answer is B. Alpha-1 adrenergic agonist. Phenylephrine is frequently administered in the intensive care unit setting for patients with hypotension that is refractory to simple fluid resuscitation. It is a vasopressor, as its mechanism of action is to serve as an alpha-1 adrenergic agonist. The other choices are incorrect, as they represent the primary mechanisms of action of a handful of medications other than phenylephrine. An example of an alpha-2 adrenergic agonist would be methyl-dopa. An example of a beta-1 adrenergic agonist would be dobutamine. An example of a beta-2 adrenergic agonist would be albuterol. An example of a beta-1 adrenergic antagonist would be tenolol. You are the nurse taking care of a patient with asthma. The patient reports using his albuterol inhaler about once a month for wheezing and shortness of breath. Albuterol functions by which of the following mechanisms of action? A. Beta-1 adrenergic receptor antagonist. B. Beta-1 adrenergic receptor agonist. C. beta-2 adrenergic receptor agonist. D. Beta-2 adrenergic receptor antagonist. E. Alpha-1 adrenergic receptor agonist. The answer is C. Beta-2 adrenergic receptor agonist. This question tests your knowledge of the mechanism of action of albuterol, a short-acting medication, frequently used in the treatment of acute asthma flares. Albuterol is an agonist of the beta-2 adrenergic receptor in the bronchial smooth muscle, which helps to dilate the bronchioles, often providing relief to patients who are suffering from asthma flares, as bronchospasm plays a large role in causing their symptoms. Additional effects of albuterol include increased heart rate, increased insulin release, and vasodilation among others. An example of a beta-1 adrenergic agonist would be dobutamine. An example of a beta-1 adrenergic antagonist would be atenolol. An example of a beta-2 adrenergic antagonist would be btoxamine. An example of an alpha-1 adrenergic agonist would be phenylephrine. You are taking care of a patient undergoing chemotherapy for breast cancer and she complains of nausea. Her physician prescribes her ondansetron for nausea relief. What is the mechanism of action of ondansetron? A. Dopamine D2 receptor antagonist. B. Serotonin 5-HT3 receptor agonist. C. Serotonin 5-HT3 receptor antagonist. D. Serotonin 5-HT3 receptor partial agonist. E. Dopamine D2 receptor agonist. The answer is C. Serotonin 5-HT3 receptor antagonist. Ondansetron functions by antagonizing the serotonergic 5-HT3 receptors both centrally in the brain and peripherally at vagal nerve endings. It is frequently given as an anti-nausea and antiemetic agent for patients with cancer undergoing chemotherapy and/or radiation therapy, as well as in post-operative patients, and for patients with gastroenteritis, among other uses. Ondansetron is neither a full nor a partial agonist of the 5-HT3 receptors, making those answer choices incorrect. Metoclopramide, which is another anti-nausea agent, is an antagonist of the dopamine D2 receptor, but ondansetron is not, so this choice is incorrect. Neither metoclopramide nor ondansetron is an agonist of the dopamine D2 receptor. You are a nurse at a gastroenterology practice and your patient is being started on ranitidine for gastroesophageal reflux disease, GERD. Which of the following describes the mechanism of action of ranitidine? A. Histamine 1 receptor antagonist. B. Proton pump inhibitor. C. Direct acid neutralization. D. Beta-2 adrenergic receptor agonist. E. Histamine 2 receptor antagonist. The answer is A. Histamine 2 receptor antagonist. This question tests your knowledge of the mechanism of action of the commonly prescribed antacid medication, ranitidine. Ranitidine functions by antagonizing the histamine 2 receptors within the parietal cells, acid-producing cells, of the stomach. This helps to reduce acid production, which can provide symptomatic relief to patients who suffer from epigastric burning, discomfort, and pain due to gastroesophageal reflux disease and peptic ulcer disease, among other conditions. An example of a histamine 1 receptor antagonist would be diphenhydramine. An example of a beta-2 adrenergic receptor agonist would be albuterol. An example of a proton pump inhibitor would be omeprazole. An example of a direct acid neutralizer would be calcium carbonate. Ethel is an 80-year-old woman who was admitted for dehydration. The nurse reports that she is not making 30 milliliters per hour of urine and the physician orders a bolus of 250 milliliters to be infused within 30 minutes. What is the correct drip rate for Ethel's infusion? A. 1000 milliliters per hour. B. 125 milliliters per hour. C. 400 milliliters per hour. D. 500 milliliters per hour. E. 250 milliliters per hour. The answer is D. 500 milliliters per hour. The minimum urine requirement per hour for most adults is 30 milliliters per hour. Based on a low finding, the physician may decide Ethel needs fluid replacement. Prescribed drip rate is 250 milliliters in 30 minutes. So, in 1 hour, the patient will get double volume, 500 milliliters. Which of the following is the preferred location of intramuscular, IM, injection in infants? A. Biceps brachii. B. Deltoid. C. Vastus lateralis. D. Dorsogluteal region. E. Rectus femoris. The answer is C. Vastus lateralis. The vastus lateralis is the preferred site of injection in infants. Rectus femoris injections may be performed as a second choice. The dorsogluteal site should not be used in infants as the muscle is not developed and there is risk associated with the location of the sciatic nerve. Deltoid injections may be given to older children when the muscle becomes larger. The nurse is preparing to administer an intramuscular, IM, injection to a 4.8-pound infant. The nurse should position the needle at which angle? A. 90 degrees. B. 60 degrees. C. 30 degrees. D. 45 degrees. E. 15 degrees. The answer is D. 45 degrees. The preferred angle for intramuscular, IM, injections is 90 degrees. However, very small infants may require that the injection be given at a 45-degree angle. Based on patient condition, it is the nurse's responsibility to assess the needs of the patient and adjust care as appropriate. The injection site varies with the age of your child. The size of the needle depends on the weight of your child and the type of drug they are taking. When injecting, hold the shaft of the syringe in dart fashion. Insert needle directly through the skin at a right angle, 90 degrees angle, into the muscle. Give the injection quickly, and do not pull back on the plunger before injecting as this causes more pain. Discard the needle and syringe in a thick, plastic bottle or Sharps container with a lid. Bring it to your local pharmacy for disposal. The new pediatric nurse has just given a suppository to a 5-year-old boy. He has a bowel movement 7 minutes post-administration. Which action should the nurse take next? A. Inform the physician that the child has had a bowel movement. B. Examine the stool for the suppository. C. Give another full dose of the suppository. D. Give an additional half of the prescribed dose. E. Consult pharmacy. The answer is B. Examine the stool for the suppository. First, examine the stool for the suppository. Based on the findings, inform the physician. If the suppository was fully present in the stool, the physician may want to prescribe another dose. If not, he may choose to reorder half of the prescribed dose or none at all. The geriatric nurse is administering nightly medications to a 65-year-old woman with dysphagia. The patient is able to swallow crushed medications with thickened liquids. Which of the following medications should the nurse not crush? A. Potassium chloride. B. Acetaminophen. C. Sertraline hydrochloride. D. Bandoprazole R. E. Multivitamins. The answer is D. Bandoprazole R. Bandoprazole R should not be crushed. ER is an abbreviation for extended release. Extended release medications dissolve over a delayed period of time. Crushing the medication results in a faster rate of absorption by body tissues due to disruption of the coating that allows its extended release. The pediatric nurse is summoned to a room by the parents of a 2-year-old child. The peripheral line has been removed by the patient. When starting a new line, the nurse carefully chooses placement. The nurse should attempt to start the IV-A. As proximal as possible. B. As distal as possible. C. As medial as possible. D. As lateral as possible. E. As ipsilateral as possible. The answer is B. As distal as possible. Most peripheral IVs are started in the right or left arm. Distal to the arm would mean closest to the fingertips. When starting an IV, always start looking for potential sites closest to the fingertips and work upwards. If a vein is punctured and becomes unusable, it is possible to move above the previous attempt and start a successful IV. Jane is a 49-year-old woman who has recently had a peripherally inserted central catheter, PIC, placed. The nurse is teaching Jane how to flush her PIC. She knows that the teaching was effective when Jane states which of the following? A. I will use a 3 ml syringe or larger to flush my PIC line. B. I will use a 10 ml syringe or larger to flush my PIC line. C. I will use a 30 ml syringe or larger to flush my PIC line. D. I will use a 20 ml syringe or larger to flush my PIC line. E. I will use a 1 ml syringe or larger to flush my PIC line. The answer is B. I will use a 10 ml syringe or larger to flush my PIC line. One should always use a 10 ml syringe or larger to flush a PIC line. Smaller syringes place greater pressure on the line, which could result in damage. For example, a 3 ml syringe places greater pressure on a PIC line than a 5 ml syringe. The pediatric nurse must convince a 4-year-old boy to take his medication. Which phrase is the most acceptable? A. Your mother and I need you to take your medicine now. B. Will you please take your medication for us? C. If you don't take your medicine now, you will need to take a time out. D. If you take your medicine, I will give you a soda pop. E. It is time to take your medicine. It tastes just like candy. The answer is A. Your mother and I need you to take your medicine now. When convincing a child to take medicine, be straightforward and clear. Try not to offer the child a choice, as they likely won't take it. Stay away from using bribery, punishment, or comparing medicine to candy. Be honest about the taste of the medicine or risk losing the trust of the child. When performing a blood transfusion, which of the following procedures should not be adhered to in order to ensure safe delivery of blood product to the patient? A. Positively identify the patient identification. B. The tubing should be of a Y type to allow for fluid and blood product simultaneous infusion. C. The blood should be administered with isotonic solutions such as lactated ringers. D. The preferred gauge of the needle should be between 18 to 20 gauge to allow for improved flow. E. Blood must be used within the first 30 minutes of arrival to the unit. The answer is C. The blood should be administered with isotonic solutions such as lactated ringers. All are true except for the use of lactated ringers. This may cause a hemolytic reaction. Only normal saline 0.9% is utilized. A nurse is teaching a mother how to administer nystatin to her 2-month-old child in the treatment of oral candidiasis. Which of the following is an appropriate instruction given by the nurse to the mother? A. Place the medication in the child's bottle. B. Apply to the mouth using a cotton-tipped applicator. C. Give the medication before meals. D. Use a syringe to squirt the medication to the back of the mouth. E. Rinse the mouth post-administration. The answer is B. Apply to the mouth using a cotton-tipped applicator. Apply medication to the mouth using a cotton-tipped applicator. Give the medication after meals and avoid rinsing the mouth. The medication should have contact with the mucosa without being washed away. Do not place the medication in a child's bottle, they may refuse to eat due to the bitter taste of the medication. Do not use a syringe to squirt the liquid to the back of the mouth since the child will likely spit it out. Which of the following is an appropriate reason to delay antibiotic administration in a stable patient? A. A complete blood count has not been drawn today. B. The patient is nauseated. C. A stool sample must be obtained first. D. Blood cultures must be obtained first. T. A blood type and screen is not up to date. The answer is D. Blood cultures must be obtained first. Obtaining a set of blood cultures before treating a bacterial infection helps to individualize care and reduce antibiotic resistance. Using a narrow-spectrum antibiotic doesn't work against so many types of bacteria. By identifying specific bacteria in the blood, a narrow-spectrum antibiotic may be chosen. A physician may prescribe a broad-spectrum antibiotic initially and change treatment later based on the results of the blood cultures. A 65-year-old male client is being discharged from the hospital on warfarin therapy for chronic atrial fibrillation. The nurse is aware that the discharge teaching needs to include which of the following instructions? A. Use a blade when shaving, avoid electric razors. B. Increase intake of leafy green vegetables. C. Warfarin is a medication that does not require monitoring. D. When having dental procedures there is no need to discontinue warfarin. E. Alcohol should be limited to no more 1 to 2 servings on an occasional basis. The answer is E. Alcohol should be limited to no more 1 to 2 servings on an occasional basis. Warfarin is an anticoagulant. Alcohol can increase this effect, so it should be limited or avoided. Leafy greens contain vitamin K and can reverse the action of warfarin. Warfarin needs monthly monitoring to check client internal normalized ratio, INR. Dental and surgical procedures may require discontinuation temporarily to avoid excess bleeding. Electric razors are preferred. The nurse is teaching a patient who has just been prescribed antibiotics. The nurse knows that teaching has been effective when the patient states which of the following? A. My mother was previously prescribed the same antibiotic. I may take some of her leftover pills if my symptoms return. B. An antibiotic will help me get over my case of the flu. C. An antibiotic might help prevent me from getting sick in the future. D. I should use a backup method of birth control if I use oral contraceptives while taking antibiotics. E. I can stop taking the antibiotics when I feel better. The answer is D. I should use a backup method of birth control if I use oral contraceptives while taking antibiotics. Antibiotics may interfere with the function of oral contraceptives. A woman who is on oral contraceptives must use a backup method of birth control to prevent pregnancy. Antibiotics should only be taken as prescribed. They should be taken continuously until all pills are gone. It is dangerous to take leftover antibiotics. Antibiotics will not prevent illness and do not work against viruses such as influenza. Misuse of antibiotics may contribute to antibiotic resistance and the rise of antibiotic-resistant bacteria. A client with a history of chronic stable angina takes nitroglycerine when needed for an acute attack. Which of the following is not associated with the administration of nitroglycerine? A. The patient may experience orthostatic hypotension. B. The mechanism of action involves increase in cardiac contractility. C. To prevent degradation, nitroglycerine should be kept in a closed dark bottle. D. Nitroglycerine can be taken sublingually by tablet or metered spray. E. The medication relieves pain within 3 minutes and provides relief for up to 1 hour. The answer is B. The mechanism of action involves increase in cardiac contractility. Nitroglycerine is a short-acting nitrate. This class of medication works by relaxing arterial and venous smooth muscle, promoting vasodilation. This medication does not improve cardiac contractility. A nurse checks the lithium level of a 28-year-old patient that has been prescribed lithium citrate and sees the level is 1.5 milliequivalents per L, and verifies that the patient has not taken more than the prescribed medication. The nurse advises the client to A. Eat salty foods. B. Drink 4 glasses of water a day. C. Exercise more often. D. Eat more red meat. The answer is A. Eat salty foods. Low sodium diets when taking lithium mood stabilizing drugs can result in toxicity. The nurse should tell the patient to eat salty foods to increase sodium intake.